warm welcome to all of you. On behalf of Neuroptech, I extend my sincere gratitude to each one of you for joining us today for this live webinar on Neuro-Visual Pathway, Interpreting Visual Field Loss. And to guide us through this topic, we have with us Ms. Brughanya Subramanian, who is a doctoral researcher in vision science at the University of Tübingen, Germany. She has completed optometry training from SRM Institute of Science and Technology, Chennai, and has also been associated with the prestigious Sankara Nethralaya Medical Research Foundation. With a strong foundation in both research, she brings a unique and comprehensive perspective to understanding the neurovisual pathway and visual field interpretation, which is extremely relevant for clinical practice as well as academics. But before we begin, a few quick points. Attendees are advised to kindly keep your microphones muted throughout the session. You are encouraged to post your questions in the chat box. We'll have a dedicated Q&A session towards the end of the webinar. Now, without taking much time, I'd like to invite Ms. Brughanya Subramanian to take over the session and enlighten us with her expertise. Ma'am, the floor is all yours.
Thank you so much for the lovely introduction, Sajaya, if I'm pronouncing it in the right way. So it indeed a great opportunity for me to share my knowledge. It is always a great pleasure to share my knowledge with all of you guys. So yeah, quickly move into the session. So I'll be sharing my screen now. So let me know if my screen is visible.
Yes, ma'am, it is visible.
Yeah, thank you so much. As we all discussed briefly, so I'll be today talking about the visual pathway, and we'll be also having a quick definitions in the visual field loss and how to interpret the visual field in a good diagnosis about the glaucoma. So yeah, so quickly we'll move into the session now. So the main objectives today will be seeing the anatomy of the visual pathway, and then we'll be able to identify common field and we'll interpret that reports, and then we'll see what kind of are present in the visual pathway and what are all its concerning field losses. So yeah, so before jumping on to the visual directly, we'll first quickly have a look at the anatomy of the visual pathway. So you can always stop me if you are feeling lost in between. So yeah, it's a quick interactive session rather than a regular webinar basis. So yeah. So basically, as you all already know, this must be the outline of the visual pathway, right? So before we understand what a visual pathways really is, we'll first have a quick look into the visual field that is present in our eyes. So basically, the visual field is actually, if you all know, it is between 180 to for example, it is between spread across 180 to 200 degrees. So as you all see, if the eye is basically divided into two parts, right? The nasal region and the temporal region. So optical fibers are present in throughout this retina, and the nasal and the temporal fibers will help you see the visual field properly, right? So can you all see the red and blue lines here in the retina? So basically the red line represents the nasal fibers and the blue line is going to represent your temporal fibers, right? So the red line here is basically going to be responsible for your temporal field, and your blue line is responsible for your nasal field. Okay, so we'll have a quick look into the visual pathway now. So the visual pathway starts from your retina and it is going to end in your visual cortex. Okay, so nasal field that you can see here is going to start from the retina. It is going to move towards the chiasm. So that is basically an egg-shaped region that is present in the center of your brain. And here, can you see the egg-spaced region that is here? So here you'll be able to see the nasal region that is going here in the red line, and the left eye's blue region that is going to cross in the chiasm. So basically your both eyes nasal field will be crossing, and the temporal field will also be crossing the chiasm, but the fibers will never cross. So the temporal field's fiber will never cross, only the nasal fibers will be crossing in the chiasm, and it will reach the lateral nucleus which is present beneath the chiasm, and from there you will have your optical radiations, and it will reach the visual cortex. So I understand that this is really confusing. We'll see each part separately so that you'll have a clear understanding of what visual field is really is. So you just have to like remember that the optical fibers that you like see here, it is going to start from the retina, then you'll have your optic nerve, then it is going to reach your chiasm, then you will have your lateral geniculate nucleus. From there you'll have optical radiations, which is the orange and the red region that you see here, and then that is going to like move to your visual cortex, which is the back side of your brain. So now we have a gross idea about what visual pathways really is, and we'll quickly have like an idea about what is a pupillary defect. So here we are not going to see about all kind of pupillary defect. We are majorly going to focus on the RAPD, which is basically the relative afferent pupillary defect. So afferent always represents the signal from your eye to the brain, and efferent is going to represent the signal from your brain to your eye. So here we are just going to see about what is an afferent pupillary pathway defect. So basically, if you have any like lesions in your optic nerve, you'll like see like you'll be able to like pick it up in a swinging flashlight test, which is going to like help you in diagnosing if it is actually like if there is any lesion in your optic nerve pathway. So yeah, we'll talk about that in briefly in the upcoming slides. We'll first like see what a swinging flashlight test really is going to like help us in identifying a visual pathway defect. So basically, like in no light conditions, you'll be able to like see in the picture, like you'll have a normal pupil representing like will be present in your both eyes. So when you shine your light to a normal pupil, the both eyes pupil will constrict, and when you shine your light to your abnormal pupil, the here I mean like the abnormal pupil is basically representing the lesion eye. So if you have any lesion in your like in your left eye, just in case, you'll be able to see that the pupil is going to dilate as soon as you're like when you shine the light. So like normally what happens is that if you shine a light to your pupil, if you are a normal person, you'll be able to see that the pupil is going to constrict. But in cases of RAPD, you will be able to like pick up if the pupil is actually going to like dilate. Okay, so when you shine the pupil, sorry, when you shine the light onto the abnormal pupil, you'll be able to like see that the pupil is going to like dilate, and you'll also see the corresponding action happening in the like other eye also. So basically, this is just a cross area. When you shine a light to a normal eye, for instance, we'll take that if my right eye is normal and the left eye is like abnormal. If I shine the light to my right eye, both eyes pupil is going to constrict, and when I'm going to shine the light onto the left eye, both eye pupil is going to like dilate. We'll have a look about what is going to like happening behind in the upcoming slides. So yeah, what an RAPD is actually like indicating is that you are having some kind of defect or lesion in your optic nerve. So that is going to like represent itself as a pupillary defect. So basically the common causes of optic nerve lesions is like, as you all know, it is basically glaucoma and other any ischemic optic neuropathies. So the kind of defects that you're able to like pick it up in a visual field mapping is that you'll be able to like see a central scotoma and an altitudinal defect. So I'll show you the pictures for a reference. And in case of optic nerve lesions, you will be like having this RAPD. Okay. So yeah. So basically, this is your visual pathway that we just like have talked about. Like for example, like this is the retinal nerve fibers, right? This is going to be your optic nerve, and this is going to be your entire like. For example, like if you have any defect in the A region, you'll able to see there is some kind of central scotoma. That is basically, for example, like assume that this circle is your entire visual field. So basically, I'm going to divide this into a 4 quadrants. So you all know that the quadrants, right? So so if I'm going to like draw a plus in this central region, so this region is basically is going to be your like superior quadrant, and this is going to be your inferior quadrant, right? So the central zone is basically going to be your the foveal region that you like see in your OCTs, right? So if you have any lesion in your optic nerve, you will be like having your central scotoma. And the scotoma is nothing but the loss of visual field, okay, in that particular region. So in case if you have any lesion in this entire optic nerve region, so if you have any lesion in this B region, so both this nasal and the temporal fibers are going to be affected, right? So you'll have the entire field loss in that right eye. Okay, so that person will not be able to like see. So basically there is no vision in that eye. So that is basically the entire visual field loss that is going to be the end stage of glaucoma. So initially that arises as a central scotoma if there is only one fiber loss, and if both the nasal and the temporal fibers are lost, you will be able to see a complete vision loss in that eye. So now we'll move on to the chiasmal lesion. So as I've explained previously, the chiasmal lesion is nothing but, so basically the chiasmal region is nothing but the X-shaped region that is present in your parietal lobe. So that is present in your center of your brain, right? So that basically is responsible for crossing of your nasal and the temporal fibers. As we all seen previously, the nasal fibers cross and the temporal fibers remain uncrossed. That is going to like pass on directly to your visual cortex, whereas the nasal fibers from the like right eye and left eye is going to cross in your X-shaped region, which is basically your chiasmal region, right? So if there is any lesion that is present in your chiasmal lesion, you will be seeing like bitemporal hemenopia. So I understand that is like really difficult for you to like pick it up. I'll explain it bit by bit. So for example, like, just a moment. Okay. So this is your chiasmal region, right? The C region is your chiasmal region. So you'll have this X-shaped structure. So I already mentioned that the structure is present in your center of your brain. So if there is any adenoma or pituitary region, you'll have the pituitary gland, which is responsible for your hormonal balances beneath the C region, right? So if you have any adenoma in that gland, that lesion is basically going to like push your chiasm up. So you will have the alteration in your anatomy. So if you have any adenoma beneath the pituitary, like in beneath your C region or chiasmal region, that is going to like push your chiasm upwards, which is basically going to like affect your retinal fibers and the visual field. So basically, so here you see that the nasal fibers are crossing, right? So if there is any like lesion in the chiasmal region, the nasal fibers are going to be affected. So as we all already know that the nasal fibers are responsible for your temporal field and the temporal fibers are responsible for your nasal field. So if there is any lesion present beneath the chiasmal region, the nasal fibers are affected, right? So here both the red and the blue line are going to be affected. So the corresponding visual field, which is your temporal field, is going to be like completely affected. So that is why you are seeing that.
Literally मुझे पूछ पे पैर रखा कहते थे
Excuse me, I think someone of your
Ritika
mics is
asked
on.
you, please mute your mic. Ritika. Okay, I think it's done.
Yeah, sure. Should I continue?
Yes, ma'am. Yes, ma'am.
Yeah, sure. So basically, as we all like seeing, the nasal fibers are going to be affected. So that's why you're seeing this bitemporal hemenopia. So bitemporal represents both of your temporal regions are going to be affected. So that's why you're seeing this temporal hemanopias. Hemanopias is basically half and anopia is loss. So basically it is loss of the temporal visual field. Okay. So now we'll move on to the optic tract lesions. So major causes of this optic tract lesions are like traumas and stroke and tumors, as we have discussed in the chiasmal region. So here you will be able to like see contralateral homonymous hemenopia. Yeah, I'll explain that also. And here you'll like may see or may not be able to like pick it up the RAPD here also. So yeah. So here, these are the optic tract, right? So after chiasm, this is your optical tract region. So here, if this field is going to be like completely affected, you'll be seeing contralateral homonymous hemenopia. The term contralateral means here, when you see in right eye, it is temporal region, and in left eye, it is nasal region, right? So that is contralateral. Homonymous means like it is like equally present in your both eyes. So for example, like it is left side. So this is if for example the gray regions in both of this map is going to be like situated in your left side, right? So if you are going to divide your visual field into right side and left side, you'll be like seeing nasal side of one eye and temporal side of other eye is going to be like your like left sided region which is going to be affected. Homonymous represents the left side. So yeah, sorry. And it is hemianopia, which is basically half of your visual field is lost. So why it is contralateral hemianopia, we'll see about like that. For example, if the D region is affected, the left eye's nasal region and the right eye's temporal region are basically like going in this optic tract region, right? So if something like is bothering in that optic tract region, you'll be like losing your vision in one side, which is the nasal side, and in right eye you'll be like losing your vision in your like temporal side. So that is actually contralateral homonymous hemianopia. Now we'll move on to the optic radiation lesion. Excuse me. So yeah, we'll see. Well, like basically, this is going to like represent as a quadrantopia. So basically, like I have already mentioned that your entire visual field is divided into quadrants. So if only one quadrant is affected, it is going to be quadrantopia, and if both the quadrants are affected, it is going to be hemianopia, right? So and pupillary reflex here is usually going to be really normal. So you'll not be able to like see any RAPD or any kind of other pupillary abnormalities here. So yeah. So here you'll be able to like see if these are the optical radiation tract, and this yellow region here represents your lateral geniculate body. So if something is like bothering here in the E region, which is like the optical radiation, you'll be able to like see the quadrantopia. So as I've mentioned, this is going to be your superior quadrantopia, since it is present in the like upper part of your quadrant, like visual field. It is going to be your superior quadrantopia, and if it is present beneath this region, it is going to be the like inferior quadrantopia. So yeah. So now we'll talk about the like last lesion, which is going to be your occipital lesion. So which is nothing but your visual cortex. So the lesions which is rising here in this region are basically like caused due to early stroke or any other trauma that is going to be like caused due to like accidents or any other things that is gonna like happen. So the common visual field defect that you will see is like homonymous hemianopia with macular sparing. So I'll explain that in the upcoming slide. And you generally don't have any like pupillary reflect, but that is not really promised. But in cases of like traumatic brain injuries, you'll also be able to like see RAPDs in few of the clear like cases. But yeah, now here we'll focus only on the visual field defects. So yeah, here you'll be like so the regions here in the F and I. So basically the lighter brown and the darker brown regions represent your visual cortex. So if something like if you have any stroke or if someone is suffering from a traumatic brain injury, the visual cortex will be affected, right? So in the eye region, if this is going to like affected, so here you'll be able to like see the inferior quadrantopia. Okay. And yeah, if as I've said previously, this is going to be your macular sparing. So when you divide your visual field into four quadrants, the center zone is going to be like representing your foveal and the macular region, right? So if the macular region is like not affected, you'll be seeing something like this. So the C-shaped white region in the center represents that the macular visual acuity is intact, whereas the temporal visual acuity is basically like affected. So when the macular region is also like affected, you'll be able to see a defined line as we saw in the previous slide. That is going to be your like complete homonymous hemianopia. But here, when you see if the central macular region is intact, you will be able to see a dent in the visual field, so which indicates that the visual acuity is also like intact and good in that patient, but there is only the field loss in the left side of the both eyes. Okay. So basically this is just going to like sum it up what we saw in the previous slide. So this is just for your reference. Maybe you can take notes from this. So this is just a gist that I just like talked about. So the diagnostic approach is basically like going to start from your like general optometric examination. So initially when a patient is like presenting to you, you'll be like examining all the neuro-optometric evaluation, right? So you'll be like testing their visual acuity, pupillary reflexes, and color vision. So and other like specific tests that you like do in your neuro-optometric evaluation, and then you'll be like examining them with the visual field. So by combining these two things, you'll be able to like come up with a correlate these findings and like come to a proper diagnosis about what the patient is really suffering from. Okay. So basically, these are the key takeaways that we just saw. So the visual field is basically a roadmap for you to like see which region of the brain is generally affected, and so that you can come and have a vague idea about, if like for example, like we saw that it is going to be if it is the lesion is going to be in the chiasmal region, you will be having the hemanopia cases. So yeah, if you see a field report which is going to like be a homonymous hemanopia, you will have a gross idea that it is the chiasmal lesion that is causing this problem. So yeah, so we have just saw about what are all the visual field defects, and what are all the visual field defects that is like corresponding to the neurological lesions which is going to cause this problem, and what kind of pupillary findings. So basically we saw what are all the afferent and the but I didn't discuss a lot about afferent problems, but we just saw a gross idea about what are all the RAPD and what kind of situations is going to arise for the RAPD situations. And basically, if you're going to like have a idea about what are all the visual field things that is going to like cause these problems, so you that is going to help you in the proper diagnosis of uh, the patient. Okay. So I think like if you have any questions, you can always like come up with this. We'll have a quick Q&A sessions. So yeah. So you can maybe like, I can give you this link in your comment box. You can, I've just created a fun Q&A sessions to make it more interactive. I'll paste this link in your presentation. You can just see like if you are able to like log on to this thing. Just a moment.
Okay, everyone, click on the link.
Oh,
It is a
sorry. Like, I
fun
sorry, I
Q.
didn't notice. Like, you can just click onto this link and like enter this QR code.
Yeah.
You can just like enter the QR code that is like there.
Ma'am, is it for the questions that they will ask? Is it like
No,
that?
no, it is just a fun and interactive sessions. Like, yeah, that
Oh,
I've created. Like, you can
okay.
just interact in that. Yeah, you can just click onto that. You'll have an idea. Just log in. Just log into that link.
Okay. So do we have to sign up or something?
No, no, I just have to like click on that link. You'll be directed to the QR page. You'll be like ask the QR code. You can like use this. No, no, yeah. I think some of them are already started to answer. Can you just hold on a moment? Let everyone join. We can this then join. Please don't answer, guys. I'll start.
The link is available right there, Fatima. Just click on it. I think they're not able to access it.
Oh, I didn't know that.
No, it is visible. I think there is a technical issue.
Yeah.
What is
Oh,
the issue? I just want to know. If you all have any problem while getting to the page, just ask us. We'll help you because it's quite easy.
uh,
It's open.
I've presented the link again.
Okay, can you all see? Just click onto this.
This will be your QR code. You can enter this QR code and join.
Okay, see, there are three options in it. The third option, click on the third option, view the result, and you will be directed to the question page. Are you all listening? Wait a second.
Like you can just click onto that link. You'll be directed directly to the Q&A sessions.
No, actually, I did it, and there are three options. The first is sign up
Okay.
for Mentimeter, and the second is open Q&A, and the third is view the results. So, if we'll click on the open Q&A option,
Mhm.
it is about we have to ask a question, and in the third
Ah,
option, we can see the
okay.
question. So, just click the third option. It
Yeah.
might be that there is different option for different people. So everybody click on
Uh,
the third option, and maybe then you can access the quiz.
yeah, sure. Yeah, you're right. You need to click onto the third option. Just a minute. I'm trying to like work it out here. Um, are you all seeing my screen? Not sure.
Okay, I need a yes from the people who have accessed the quiz. Just give me a yes. I need to know how many people are looking at the quiz right now. So that way we can get an idea of,
Yeah.
okay, one yes, more people.
Yeah, add the code. Yeah.
Yes, yes, yes,
You need
that's
to add
one
the
way
code.
you can do it. Yes, you're right. Yes. Okay, Teja, you cannot access it. Try it once again.
Yeah, just wait. Like let everyone join and then I'll start to like change the slides.
Shagufta, just do it once more. Just click on the link. Okay, everyone, the link ma'am has shared at 12:57 p.m. I think you need to click on it. Just try doing that. Oh,
Yeah.
Riddhima, there are three options. If you cannot open it via one option, try the second option. Have you tried opening with the link that ma'am has shared at 12:57 p.m.?
I'll share it again. Just a moment.
Okay, now this is, I think this is the last time we are doing this. Who all have entered the via the link this time, we'll start with the Menti quiz. Okay, ma'am?
Yeah, sure. Maybe I've just like given them another chance.
Yeah, yeah, yeah. Let's give them one more chance.
Mm-hmm. I could see 19 participants. So I guess 19 of them has joined using that link.
Yes, yes, yes.
Yeah, I'll just share my screen here.
Okay, now Riddhima has joined. I think a lot of people have joined.
Yeah.
And yes, you can share your screen as well, ma'am.
Yeah, sure. Yeah, I'll start the Q&A here. So yeah. This is just a warm up, guys. So you can just type in your responses. I'll be like changing the slides. The questions will appear onto your screen. You can just like give a like, heart, comment about what is your thought about this Minty, and then we can start the session. Okay. So yeah, this is just a random warm up question. You can answer it. I think the answer is already there. So a few of them is already answered. You can start answering this slide just for you to like have an idea about what a Menti is. Yeah. Yeah, I think you can answer this question. Yeah, you can go ahead and answer this. You can see the response in the screen in the meet. So,
I think this will give people an idea of what a Menti
yeah,
is.
yeah, exactly.
लेट मी जस्ट स्विच इट अप इन हिंदी जो लोग भी जुड़े हुए हैं स्क्रीन पे आपको एक क्वेश्चन नजर आ रहा होगा बहुत ही बेसिक सा क्वेश्चन है आप उसे इंटरेक्ट करो ये एक वार्म अप क्वेश्चन है उसके बाद आपसे वो टेक्निकल क्वेश्चंस और एकेडमिक रिलेटेड क्वेश्चंस आएंगे अभी आप इसको इंटरेक्ट करो और रिस्पॉन्ड करो ओके ओके
So,
31 or 49 have already responded.
yeah,
Okay, I think people are understanding how it's working.
yeah, just that's why I gave them this warm up question just to have an idea about what it is really is.
Yes,
Okay.
yes.
You can also comment, right? It's just like a social media platform, guys.
Yes, yes, yes.
Yeah. Rather than having a simple Q&A, I thought of like organizing this so
This just
we can.
gets a little bit more interactive and
Yeah, it is more interactive, right? It always works for the crowd. Yeah. So, so should we start now?
yes, ma'am, I think. I think everybody
Sure.
got the gist of it, right? If
Yeah.
anybody has a question regarding Menti, put it in the chat box.
Mm-hmm.
अगर अभी भी किसी को कुछ समझ नहीं आ रहा है तो चैट बॉक्स में क्वेश्चन डाल दो हाँ ओके ओके आई थिंक वी हैव अ yes from Suguna. We can
Mm-hmm.
start.
Yeah, sure. I'll move on to the actual Q&A sessions now. So yeah, 97% of you have answered the right one. I think 3% of you answered January 9th. I don't know why, but you can have fun with this, okay? Yeah. Okay. Okay, like central scotoma is caused due to defect in, like there are three options. You can click on to the right option. Yeah, you can see like the number of persons answering the questions. Like you can see the percentage also. Like yeah, 25% have answered LGB. 17 of them have answered optic radiation. You need to be real quick. Okay, I'm going to change the slides. You need to be like real quick in giving your answers. Right. I can see the graph variations here. You can also like have a look at it in your Google Meet. Also like see the number of persons answering this, right?
Mhm.
Yeah, you can have a quick discussion in your chat box. You can ask your friend like about the questions. Okay. So I'm gonna change it. We'll see the answer, right? Have everyone answered?
Yeah, I think it's
So
yeah,
I
it's
think yeah, you will see what is the right answer is. So I could still see the graph is moving. So guys, be real quick. I'm gonna like change the slides.
थोड़ा जल्दी जल्दी करो सब लोग. Be a little bit quick, please. Because you have to move on to next question, right? एक ही question पे तो फिर
Yeah.
शाम हो जाएगी.
Yeah, yeah. You can answer anything, guys. It is anonymous. You'll not be able to like see the names of what answered here, right? It's just for you to like have a fun interactive session, right? So I'm gonna like switch on to the answers. So yeah, 68% of answered correctly. So the answer is optic nerve, right? So yeah, so then we'll move on to the next question. So which lesion is most likely to produce RAPD? You can start answering, guys.
चलो चलो, be quick about it.
Quick, be quick. I could
There
see
is no negative
responses.
marking, guys. I think you all have been way too traumatized by NEET. There is no negative marking. Just go ahead with whatever you want to
Yeah, and nobody is actually going to see who is answering like what option, right? It is anonymous. Yeah, you can answer anything here. It is just for you to like have a interactive session with your friends. You can have a chat in your chat box with your friends here. I could see the responses coming in. So yeah. So I'm gonna see the answer now. Okay. So the here like yeah, the next question is chiasmal lesion causes. Okay. Yeah. You can type in your answers here. Yeah, you can see the answers like popping onto the screen. You can just have a look at it your Google Meet to have a like better idea. You can type in like you can type whatever that is coming onto your mind. It is completely anonymous. Yeah. Yeah. The answer is popping onto your screen. You can just have a look at your Google Meet. You can answer, guys. Like only 8 of them have answered.
keep answering, everyone. Be
Yeah, yeah.
interactive.
What kind of visual field defect? Be specific. I think bitemporal hemanopia is the right answer. You can type that also. Like, yep. Be specific, guys. Yeah. There is no right and wrong answer. I just want you to be like really interactive so that like I can have this as a interactive session. Right? Yeah, I can see the answers popping on. So the right answer is bitemporal hemanopia. So I think we can move on to the next question. So yeah, quadrantopia is caused due to lesion in. You can just enter your answers.
Write your answers there, Lalit. The mentee is going on I think you all are getting a little bit confused. Do not write your answers in the chat box of the Google Meet. Write your answer in the Menti quiz.
Yeah. So we'll move on to the next question then. Okay. So yeah, you'll be able to like see fundus image on the visual field defect that is here. So you can like refer that and give your responses in the Menti. What kind of visual field defect is that? You need to like answer and where the lesion will be present for this kind of lesion. Everyone can answer, guys. Only 17 of them have answered.
Whatever you're thinking, okay, you're unable to write answer, Priya. Okay.
You need to like join using the QR code that is on your screen. Then that's why like that's when you'll be able to like access Menti.
Okay, maybe that is why people are answering less. Maybe they're not able to answer.
You need to like like type in this QR.
आपकी स्क्रीन पे आपको
Just
क्यूआर नजर आ रहा होगा ना, आप उससे एक्सेस करो उसको.
just typing that QR code, guys. So we'll switch to the next question then. Okay. So the right answer here is the optic tract. So 79% of them in this group have answered correctly. Well done, guys. So the next question here is like, what kind of visual field defect is this? Yeah. The image is right there, guys. Just have a look at it and then you can type in your responses.
Okay, Priya, I think you need to close the tab and join again. It is a network glitch or something. Just do it.
Come on, you have to be really quick. The one person who have answered homonymous seminopia, just have a look at the image again. Think about it and then like you can answer again.
It is quite clear. Ma'am has already taught. There are quadrants. It's quadrantopia. Look at it. At this point, this is not even a technical question. It is an English question. Just look at it. This is a quadrant.
So I'm switching to the next question, guys. So yeah. So the right answer is quadrantopia. So because only one region of this entire visual field is affected, right? Only one quadrant to be precise. Yeah, that is affected. So that is basically quadrantopia. So yeah, identify the type of defect here, guys. You have to be real quick. Yeah. Just match the visual field defect to that of the fundus.
Okay, is this the last question?
Yeah, this is going to be your last question.
Okay,
So you have to
okay.
be really quick in answering.
Be interactive, people. Only 31 out of 59 have responded, and it is
Yeah.
not even a subjective question. What happened, guys? We'll take your questions now, people. So be quick
Okay.
with this.
So I am giving you a minute and then I'll close this. Okay.
Okay, this is your last minute. Be as
Mm-hmm.
interactive as you can. Answer this. Menti is a very fun experience
Yeah,
for
it
me.
is actually. When you have a larger crowd, it is actually easier for them to be
Yeah,
like anonymous and answer. People
yeah.
like basically will shy away from asking answers. So this is actually a good platform to have an interactive session.
And it is interactive and interesting for the students as well. It's very
Yeah,
interesting.
exactly. Exactly. Maybe you
And
can use in your regular classes also.
yeah, I have gotten a
Yeah.
new idea.
Yeah, of course. Yeah. So, guys, your time's up. I'm going to close the session now. Okay. So, yeah, we'll see the answer. So, 94% of you have answered the right one. It is basically central scotoma. The people who have answered hemanopia, I think they got confused between the two dots here. So, hemanopia is going to like present in the entire left side of your field. It is going to involve both the superior and the inferior quadrant, guys. So, don't really confuse about it. Okay. So yeah, I think the session is ended. Thank you for answering. I think I really had a good time here, having a really interactive session with you guys.
Oh,
So
thank you
thank
so much,
you.
ma'am. Thank you so the session was really very insightful and it was very beautifully explained. I mean, the
Yeah.
visual things are quite easy to memorize. So, thank you so much for
Yeah.
that.
Yeah. Yeah. Thank you so much for joining today, guys. I really had a good time with you.
You're
Thank
welcome. You're
you.
welcome.
Thank
If by
you.
any chance, can you take some questions that our attendees have?
Yeah, sure. Yeah, sure. Like, what
Okay,
are all the questions?
while we were presenting, we had a question by Teja. He wanted if you can kindly explain about quadrantopia again.
Ah, okay. So basically, like, I'll present my screen here again. So this is generally your quadrantopia. So basically your visual field is divided into four quadrants, right? The superior quadrant, inferior quadrant, and it has two sides. So nasal side and the temporal side. If only one quadrant of the four is affected, it is called as the quadrantopia. It's basically like your pie chart that you have like already studied in your math. So if only like a quadrant of the entire visual field is affected, that is going to be your quadrantopia. And if one the superior and the inferior quadrants are affected, it is going to be your hemanopia. That is one like one half of the field is affected. It is going to be your hemanopia, and only one quadrant is affected. It is going to be your quadrantopia. If it is clear now, not.
I think you did you get it? I think maybe he did. And I think there is another question by Riazul. If a lesion behind the optic chiasm can cause an RAPD, can that be a
Uh,
positive?
but that really depends. So just a moment. I'll show that slide. It's okay. So what we generally see here is like, just a moment. RAPDs are generally like going to present if you have like optic nerve lesions. So that is basically the one side of your eye part is going to, for example, like if your right eye is going to have an RAPD, the entire optic nerve is going to be like affected with the lesion, right? So that is like actually like presented only towards your optic nerve, not like beneath or like beyond your optic chiasm. If I'm like really clear about it. Did I answer your question? For example, like if your lesion is present in your optic nerve, then you'll be like seeing an evident RAPD. And I've also mentioned that if you like experience a traumatic brain injury, there are chances that you might have an RAPD, but that is not really necessary that you get it every time that you have a traumatic brain injury. So that is like really subjective. So when you see a lot of clinical cases, you will be able to like understand it clearly. But as of now, you can just imagine that if any lesion is present in your optic nerve region, then that is going to be presented as an RAPD. So, am I being
Okay.
clear here?
Yes, ma'am, you were quite clear about it.
Ah, okay, yeah, sure.
I think there's another question. If you can please explain about Anderson's criteria.
Sorry, what?
There was a question. Kindly explain about Anderson's criteria.
So basically, that is going to be your like pupillary dysfunction. So RGL Robertson pupil, if that is what you're referring to, if I'm like clear about it.
Okay, we have another question
So
by
that is
Teja.
basically a pupillary. That is your pupillary defect. So that is similar to your RAPD, to be like clear. So yeah.
Okay, okay. We have another question by Teja. Can we diagnose visual field defect with a viewing disc image, ma'am? Because eighth question had fundus image, but I found the answer by looking onto the field image.
Which one? Sorry, I'm not
I
getting
think
your
he's talking about the
question.
mental quiz that happened.
Okay. Sorry. Just a minute. I'll have like what were you like answering? Like, can you be
The
like can you
question
repeat
is,
the
can
question
we
again?
diagnose visual field defect with viewing disc image? Can we
With the
diagnose it by looking at image of the disc?
image of the visual field?
I think he's talking about disc. Teja, can you unmute
Disc.
yourself and
Oh,
ask the disc,
disc.
disc,
Oh,
optic disc?
oh, disc. Okay. So that is a bit of a tricky question, you know, like you'll not be really able to like pick it up your visual field defect based only on your desk region. So that is why we are performing the visual field perimetry to identify which regions of your like entire retina is affected with that is going to cause your this defect. So for example, here, as we have discussed, just a moment, I'll set my screen again. So here, if you see, like that Menti question had central scotoma, right? So I've mentioned already that the central scotoma is going to arise only if you have like lesion in your optic nerve, right? So here, when you see, so this is going to be your fundus image, right? There is going to be thinning in your optic disc region, so which is basically your like optic nerve region is entire nasal and the temporal fiber is going to be affected, and you'll have this monocular field loss. But in that image you saw only the central scotoma, which indicates that the disc is affected. So the thinning might happen only in either the nasal region or the temporal region. So it is going to be like evident in your like regular ophthalmology examination that there is some sort of disc thinning, but you'll not be able to like pick it up what kind of like scotoma is actually there in the patient, right? So for that you'll have to like do the visual perimetry to identify like what sort of like thinning is there in which region. So if you have a look at my Menti question, just a moment, I'll see. So here, this is the thing that you're asking about, right? So here you saw there are like thinning in your central region, which is going to be your central scotoma. So here the disc thinning is visible in this eye, but you don't know if that is only like representing only this side or the entire central region, right? So that is why visual perimetry is actually like helping you to diagnose which data points or is basically like affecting your with that thinning. So you need to like always do a perimetry in order to like have a like entire idea about what really happening is inside the retina. So did I answer your question now?
Yeah, I hope
So
that
yeah, to conclude that you'll not be able to like diagnose only with the help of fundus photo. You'll always have to like, need to perform the perimetry to identify what sort of like defect is happening in your retina.
Ma'am, we have another question by Priya Hirani. Every glucomatous glaucoma.
Excuse me for that. So yeah, so not every RAPD is related to the glaucoma, as I've said previously. Like neuro things are related to the RAPD rather than only focusing on the glaucoma. So yeah, that is really subjective. You will not be expecting like a open angle glaucoma to always have an RAPD, right? Only if you have optic nerve thinning or optic neuritis, in that cases you will be able to like pick it up your RAPD. That is not really only associated with the glaucoma. You need to do the neuro-optometric evaluation in order to like see like if there is any RAPD.
Okay, okay. Now we have a last question by our founder Adnan. Do you want can if I can take it?
Yeah, yeah, sure.
Okay, okay. So Adnan has written, Good afternoon, ma'am, and thank you for this great presentation. I am Adnan, the founder. Sorry, I can't open my mic due to some disturbance. The question would be a link to more brain anatomical basis, if possible now. My question is, ma'am, in raised intracranial pressure and lesions of the cavernous sinus affect vision, describe the anatomical basis with reference to the visual pathway and adjacent cranial nerves.
Oh, that is
If
kind of so like as far as I understand, like I'm not really clear about what you're asking, but I understand that if there is any raised intracranial pressure, you'll be like seeing a not that is not going to be like really restricted towards your like only but I saw one of the cases in my UG days, so I'm like able to like correlate with that. So basically, that if there is any kind of increased intracranial pressure, that is going to affect your optic disc, right? So you will be like having lesions only in your optic nerve region. So I think like that can cause your field loss. If I like really answer your question,
yeah,
or did
I
I
think
understand it correctly? Like
no,
if
no, I
you're
think
like
that's what he was asking about.
yeah. So
Yeah.
basically, intracranial pressure is always like it is not really correlated with your regular blood pressure. That has to be like caused in cases of hydrocephalus. So if you have seen like sunset syndromes, like in children, the intracranial pressure might increase in such cases. So you'll be like seeing optic neuritis problem more frequently when than the visual cortex problems. So yeah.
Actually, yes, yes. Okay, so that sums up the questions. And yeah, Adnan has responded. He
Yeah,
understood it
sure.
pretty well.
Yeah,
So thank you so much, ma'am, for your valuable
yeah.
time and for sharing your knowledge with us today. As we are going to end the session, I would also like to thank Adnan and Asad, our founder and co-founder, and Arman, our administrator, for their dedicated efforts and seamless coordination behind the scenes. In the end, I would also like to thank all the participants for their active involvement and for thankfully understanding what Menti is. Guys, please stop being so technologically retarded. Also, we hope today's webinar added value to your learning journey. Have a great day ahead. Stay curious and keep learning. That's all for today. This is Shazia Shabir, your moderator, signing off. Thank you so much, ma'am.
Yeah, thank you so much, Shazia, for moderating this session. I really had a great time with you all. I hope that you got an idea about what Menti really is. You can have a look at it and you can use it, okay, in your further presentations. This is going to just enhance your like presenting experience, I guess. So yeah, of course. Thank you
Yeah,
so much,
yeah.
Adnan, for hosting me. And yeah, I really had a fun session, guys. Thank you so much.
You're most welcome. You're most welcome.
Thank
I
you.
personally have used it plenty of times when I was
Oh,
in my gap year for NEET preparation. I think maybe it's new. Maybe people have forgotten about it because they're not preparing for anything right now. Maybe that's
yeah,
the
yeah. Oh, that shouldn't be a issue here. I think like you always have ChatGPT for your use. You can see
yes.
like there are multiple polls that you can use and make like you can use to like make your presentation more like interactive. It's just that to you can also like always use it as a tool to like see if everyone is really like active in like listening
Yeah,
to the
in the
presentation, because
session.
few of them
Yes.
will like put it on mute and like do
Yes,
their
yes.
own job. So yeah, you can have this to have a reality check with them. So So
Yes, ma'am.
yeah, so I was just kidding, guys. So I really had a fun time. So yeah, thank you so much.
You're most welcome. You're most welcome, ma'am.
Thank you,
Now,
guys.
attendees, scan the QR code for your certificate, fill up the form, and we'll send you your certificate in 24 to 48 hours. Just take the screenshot if you all want, and you can fill it up later. Okay, I think by now everyone must have done this. So that's it. Thank you, everyone. Thank you so much, ma'am.
Thank you
Have a
so
great
much.
day.
Thank you. Have a great day. Thank you.